Nachiket Mor, a visiting scientist, the Banyan Academy of Leadership in Mental Health. He has in the past been an RBI board member and also the India country director at the Bill and Melinda Gates Foundation. I'd like to ask you, Mr. Mor, what is oxygen therapy and how is it useful in the treatment of COVID-19 patients?
We know that the manner in which the disease progresses, almost 80% of the people who are infected recover without any treatment necessary at all. The 20% that do need treatment, we also know that somewhere near 80% of those actually recover with basic oxygen therapy, which comprises low flow oxygen and high flow oxygen, well before they need ventilation.
And Mr. Mor, how has ACT been involved in this, and what sort of difference are you seeing it make?
So ACT realized fairly quickly that there were two challenges that the country was facing. One, there wasn't an adequate supply of devices that were needed. Those that were available were largely imported and fairly high cost. And the second issue was there wasn't an adequate supply of oxygen that needed to be addressed. So in both of these areas, ACT decided to intervene. On the oxygen side, it was relatively simple to make available wherever there was demand, particularly in remote areas, in high impact states, oxygen cylinders that were required. But for the HFNC, the high flow nasal cannula, the high flow oxygen devices, more work needed to be done because we needed to find a local entrepreneur that had the capability to develop a device that was at a low cost, to get it tested with variety of hospitals and to get it approved and authorized. So we played a partnership role to try and make this happen and to actually successfully get out a far lower cost domestically manufactured HFNC device in the system. Thus far, we have supplied over 1,000 oxygen cylinders,
right,
and over 100 HFNC devices.
Right. Thank you so much for being with us this evening.